Some of our students and people that follow our school have actually submitted in some questions about the voice, and we would love to know what you think of these questions.
Sure.
The very first question is, how does the voice have the ability to change in pitch?
Well, hand that one over to you, Doc.
Sure. Well, I think you first need an understanding of how the voice is made and understanding of the sound that's generated at the vocal folds. And essentially what we have is we have two vocal folds which have muscles which contract and bring the vocal folds to the midline, to the middle, and then you have the jelly-like lining the vocal folds over the top, and with a column of air from the lungs and the vocal folds being brought to the middle, we create a sound. And then that sound can be modified. And it can be modified by how tightly we bring the vocal folds in and how much we stretch the vocal folds. And those combinations will change the pitch of vocal folds. Now there are limitations to the amount that we can tighten and elongate the vocal folds. And that relates often to, or mostly to, the natural shape of the larynx. And to that shape of the larynx is what you're born with. There are other factors that can contribute towards the production of sound. And that's how high we hold the larynx or how low we are able to descend the larynx on phonation. And then also all the articulation, resonation, changes to the sound that's produced, which is in the throat and the mouth and articulators and the lips, for example.
Fantastic.
But pitch, I suppose, one of the easy ways for students to understand pitch is that if we think of the vocal folds as strings, we know that a short string makes a higher pitch, which is why children and babies have a higher pitch voice. And as we grow, the vocal folds get longer and the pitch drops. And the other thing we know about strings on a guitar is when you tighten the string, the pitch goes up, and when you loosen it, it goes down. And as Dr. Stewart was saying, we can manipulate the muscles in the vocal folds to make them tighter or looser, but we can't make our strings shorter or longer because that's what you're born with and that's what develops as you get older.
Fantastic. That's amazing. One of the other questions that comes to curiosity is, how do we make our voices loud and soft?
So loudness and softness is all got to do with the amount of air that we're pushing across the vocal folds. So when we want to make our voice loud, we push more air across the vocal folds. And so loudness does not come from the throat, that comes from your lungs. And this is where the experts on singing techniques will teach you about your posture and how to sit and to make your lungs work best, and how to use diaphragmatic breathing, which can, so if you strengthen your lungs and push more air across your vocal folds, you'll be louder. One of the things that some people do incorrectly, and this is what we call bad technique, is they try and push from the throat to get loudness. And if you squeeze the muscles in the throat to try and get louder, what happens is you actually muffle the voice, and it actually gets softer, or it doesn't resonate as well. So loudness comes from the lungs.
Yes, and I think as well, as we go up in scale as well, you get softer. So a lot of people think that rock singers built volume, but it's actually softer when they're doing rasp and distortion, because you need less air pressure to create those sounds.
Expert. Yeah.
Yeah, so it's cool, because I'm like, yeah, let the doctors tell the students, it's fine. Okay, so one of the other questions that we get is, why are male voices typically lower than females, and what factors cause a person to have their own unique voice print?
So I'll answer the first part of that. So once again, the pitch of the voice in females is generally higher because the vocal folds are shorter. So when we hit puberty, we grow. In females, the larynx grows the same sideways and front to back. In men, because of testosterone, the Adam's apple develops. And the Adam's apple means that the vocal folds are growing longer front to back. And that's why the pitch drops. And that's what we call the voice breaking, because the pitch drops all of a sudden, because not all of a sudden, but over a year or two, because the length of the vocal folds extends much more than in a female.
So that has to do with the thyroid cartilage, is that
the thyroid cartilage,
yes.
Which is the Adam's apple, basically.
Yeah.
And the particular qualities, I think you've mentioned this before.
Yeah.
I started to talk about that, and that's really those unique features of the shape, the pliability and the control of all of the components. So not just where the sound is generated from, the voice box, but also all the changes that are created. So there's the initial sound, and then there's the resonance that is created. So there's the shape of the throat, the shape of the nose, the sinuses, the mouth, the tongue, the lips, and then the control of those. And so those are the components, and the nature of which those all interplay results in an individual's voice pitch.
That's fantastic, and it also shows from a singing teacher's point of view that every voice is different and we must teach accordingly rather than doing what's called like box teaching where we teach everybody the same thing. So I absolutely agree with that, 100%. Do you have any advice for teachers who may be training underdeveloped voices?
When you mean underdeveloped, you mean?
So child and under the age of maybe a mature voice.
I think the most important thing with a child, the vocal instrument of a child, is different to that of an adult. So when you're teaching a child, the repertoire has to be different to an adult. You can't ask the child to sing in a key or have that same transition change as an adult. And this is often what happens, that people run into trouble when they're singing outside their repertoire, outside of their tessitura or their natural range. The sweet spot, yeah, exactly, the tessitura. And so that's our biggest recommendation. And also, I think also for teachers and parents to be aware that the vocal capabilities of a child are less, and often we see children who run into trouble because they're doing too much with their voice. Not only are they singing 5 days a week with their teacher, they're singing in the shower, they're doing debating, they're playing sport, they're yelling at their brothers and sisters, and that's a big risk factor for developing phonotraumatic lesions. The most common with is nodules. So I think any developing voice, they need to know their limits, and I think that the best thing that happens as you get older is your instrument stabilizes, it stops growing and you start to master it a little bit more.
Yes.
Because when you're growing, your instrument's changing all the time.
Especially males as well, and that changes.
Yeah, but well, actually females, it's even more challenging.
Really?
Yeah, absolutely. So you might, when you're 11, you're playing a banjo, and then you're playing a big acoustic guitar 5 years later, and so your instrument's changing because the shape of your vocal track's changing, your vocal folds are changing. So sometimes getting the control between the age of say 11 to 18 is the most challenging thing to do.
Wow. Before we get to the fun facts that you'd probably like to share, no pressure, we'd like to know for students that are a little bit more aware of vocal anatomy, vocal function, if you can just elaborate a little bit on what formants are.
So I've kind of, I guess, given a lay description of them in those discussions of resonance, but formants, I like to think of them as really as filters. And so formants go hand in hand with the idea of what harmonics are. So harmonics are generated by the vocal fold and the overlay of different frequencies.
Yep.
Much like any string instrument, you play 2 guitar strings adjacent and you get harmonics, you can hear that quite easily. And formants are not the same, but they're a counterpart. So formants are more the filtering of the sound that occurs due to the natural dynamics of the tissues, of the larynx, of the throat, of the tongue, of the resonating chambers. And based upon what positions those are in, they can make sound softer and louder.
Beautiful, so like resonating boosts almost, and the change of that resonance and that tone as you move up and down the scale.
That's right.
Beautiful. Alright, so before we finish the interview, do you guys have any fun facts you'd like to share with our students or those watching?
Now you put us on the spot.
So, fun fact is the sort of main thing that I think we should talk about is how people think nodules are a career ending sort of thing.
Beautiful.
Because they're not. They can just represent technique, and they can just represent something that's already there. And I think there's often a fear that when people come here and they think that you need a perfect looking larynx on the screen, and that if there's a finding it means something. We have expert professional singers who have asymmetric larynxes, or they have small lesions which are not consequential. And I think there's a fear component that's the biggest issue. And I think a lot of the time, half the consultation is discussing with the performer, the singer, their anxieties about what they're going to see.
Correct.
And that's really important to not be fearful. I think that's really important.
Beautiful.
Really important point.
Yes.
Because nodules aren't a career ender. They might just be something that's unrelated to the problem.
For those that may not know, what is the difference between nodules and polyps?
So nodules can be thought of as subepithelial thickenings, and polyps is more just a description of the shape and the gelatinous nature of it. So essentially a nodule is a firm, hard, potentially pre-scar-like change.
Almost like a callus that you might get from walking on your feet, from walking on hot road or something. Yeah, you might get a little callus, and that's what nodules are. They're when we start to get a thickening of the vocal fold.
When does it become a surgical thing? At what stage does nodules become something that need to be...
Very, very far down there. Very, very far.
Really?
Yeah, we rarely operate on nodules. So if it needs an operation, it's probably not a nodule. That sort of nodules can develop. Well, nodules can develop, but nodules by definition are reversible.
Yes.
So if you change the behaviour, they'll go away or they'll soften.
Yeah.
If nodules become hard, then they turn into scar tissue. That is a potential surgical thing. So that's why it's good to get them assessed and to change that behaviour. We don't cut nodules out because if you don't change the reason why they developed, they'll come back.
Right.
Now sometimes we might do a little cortisone injection or something to soften them, but they go away with speech therapy and modification techniques.
That would bring a lot of relief to a lot of our singing students and
we don't
students
operate,
of the world. That'd be amazing.
We don't operate on singers unless we need to, but if we need to, we know how to do it.
Excellent. Well, thank you very much, Dr. Novakovic and Dr. Stewart, for taking the time to interview. Well guys, I hope you enjoyed episode 3 where they answered your questions. If you'd like to check out episode 2 where we interview Dr. Novakovic and Dr. Stewart about vocal care and condition, you can click here. Or if it's not already here, will be coming soon, you can check out the final episode of our series where I get a laryngoscopy, an exam and results, so you guys know what it's all about. Wherever you are in the world, I hope you are safe and I'll see you soon. Rise above and love. Mwah. Bye.